My name is Bommier. I'm from Saint Louis Hospital in Paris. I'm working in lymphomas, but I'm also a member of the Young EHA committee. And with EHA last year, we had this wonderful initiative, which was called the Burnout Initiative. And so we first had a webinar on burnout, and then we set up a survey among hematology professionals, among EHA members, to evaluate the rate of respondents that would declare severe symptoms of burnout. So this assessment was based on the MAS/Burnout Index, which is a widely validated tool to assess burnout as occupational syndrome, and it relies on three core dimensions, which are the emotional exhaustion, the high emotional exhaustion, the high depersonalization, and apart from the two first, you have the low personal accomplishment. And so we could survey more than 1,840 people from the EHA community. And so most of them were clinical hematologists, but there were a panel of various roles in the same survey. And what we discovered is that 42% of the respondents declared presenting severe symptoms of burnout, of high emotional exhaustion, and a third of respondents were having high depersonalization. So aggregating these two scores, we ended up with a 50% rate of respondents with severe symptoms of burnout. Aside, we had the low personal accomplishment assessment, and it was even worse because 2/3 of the respondents declared having a low personal accomplishment at work. So this is very, very concerning, because we all came into that medical practice for helping others and taking care of patients, and at the end of the day you realize that half of them have severe symptoms of burnout and 2/3 of them have a low personal accomplishment. So then we try to associate factors with the high burnout and the low personal accomplishment to know what were the drivers or the predictors. And we, of course, it's similar to what was found in the literature, for example, in oncology, same kind of high pressure fields with exposure to death, for example. And so what we observed is that long hours, being a female, being a young practitioner was associated with high burnout, but also seeing patients every day from Monday to Friday without any break. In parallel, we asked the respondents what were the challenges they were facing on a daily basis, and obviously they said, it's the workload, the number of cases, the long hours, and so on, the administrative work. But finally, the challenges that were associated after adjustment with high burnout were the lack of support, the lack of control and autonomy, and the poor management. So 3 systemic factors. So in parallel, we have this other analysis to assess the predictors of low personal accomplishment, and some of them were similar to the burnout prediction: female gender, younger age. But for example, doing long hours or seeing patients on a daily basis was not associated with low personal accomplishment. Conversely, being a senior, having an academic position, a tenured position, was associated with lower risk of burnout and higher personal accomplishment. So this is really a call, important one, because this is the first study, the first survey conducted among hematology professionals, and this is a huge issue that needs to be addressed, because at the end it really interferes with patient care as well. And this we really outline the idea that systemic factors are prevalent and predominant above the personal factors. And it's not about the personal resilience, it's not about the confidence, the self-confidence, it's about changing systemic issues, acting on gender disparities, for example, and giving more opportunities and more recognition to the laboratory workers as well, which is very important. And so this is why we we are very proud to have run that survey, conducted that survey, and we do hope that there's going to be something else afterwards.